Here I'm going to discuss different GI disorders that you will have to know for your STEP exam. And so the GI disorders that are listed in the right column, I have discussed them in a separate video. And so for now, I will focus on the GI disorders that are associated with the lower GI bleeding. And so this list is very handy if you can memorize that. And it's that during your medical school rotations as well as during residency, you would be able to come up with a differential diagnosis when you see a patient with GI bleeding. So the first cause of GI bleeding is diverticulosis, which is a sac-like protrusion of the colonic wall, as a consequence of which there would be weakness of the GI arteries, as a consequence of which it will predispose them into the rupture, and thus it can cause GI bleeding. Common risk factor to diverticulosis includes advanced age as well as low fiber and high fat diet. Now, some of the older physicians may tell you that the nut, corn and popcorn consumption may also increase the risk of diverticulosis. But then new research shows that these foods actually do not increase the risk of diverticulosis. So the main risk factors includes advanced age and low fiber, high fat diet. For the management of these patients, you will have to identify and stop the site of bleeding, so you can either use the colonoscopy or angiography. Now, diverticulitis is another condition that results from inflammation of the diverticula. So you know how we have all these diverticula, which are the colonic protrusions that are found in the colon. Now, if these diverticula gets inflamed, then that's the time we refer to as diverticulitis, means inflammation of the diverticula. And since diverticulitis is most commonly affecting the sigmoid colon, therefore these patients are usually presenting with the left lower quadrant abdominal pain. Now, as for the pathophysiology of diverticulitis, it's thought that the obstruction of the diverticula will cause increased diverticular pressure that causes creation of microscopic perforations, as a consequence of which it will cause inflammation, and thus it will cause the abdominal pain. And then for the treatment of these patients, you will have to provide them with the bowel rest, with the clear liquid diet, so that the GI tract doesn't have to work as hard. And then you have to provide them with antibiotics, which includes ciprofloxacin as well as metronidazole. The next condition that causes lower GI bleeding is bowel ischemia, which is due to the decreased blood supply to the colon that is more commonly seen in elderly patients. And the common risk factors to bowel ischemia includes, for instance, hyperlipidemia, where the atherosclerosis of the mesenteric arteries will cause decreased perfusion of these arteries. Alternatively, conditions like arrhythmia, which can cause blood clot formation and thus blockage of these arteries, can also cause bowel ischemia. And so the part that is being most commonly affected is the watershed areas, which is an area of a bowel that is being supplied by two main arteries. For instance, the splenic flexure that is shown here is being supplied by both superior mesenteric artery as well as inferior mesenteric artery. Likewise, the rectosigmoid junction is being supplied by the internal iliac artery and the inferior mesenteric artery. And so these watershed areas have a limited collateral blood flow, as a consequence of which, once there is a hypoperfusion of these arteries, these would be the sites that would be affected first. And so the symptoms that you would see in these patients is, for instance, left-sided abdominal pain that corresponds to the sigmoid flexure, and this is usually after consumption of food. And so what happens after eating food is that that's the time that GI becomes active, and so it will need more oxygen from the blood supply of the mesenteric arteries. And so that's the time that if there is decreased perfusion, the patient will start to feel the abdominal pain. So left-sided abdominal pain, which corresponds to the splenic flexure after eating, is usually observed in patients with bowel ischemia. And then these patients may or may not have rectal bleeding. The next conditions that can cause lower GI bleeding includes hemorrhoids as well as anal fissures. So hemorrhoids are from bleeding from the submucosal veins that are located either above or below the dentate line. And so if they're above the dentate line, those are the internal hemorrhoids, and if they're below the dentate lines, then they're the external hemorrhoids. And so for the treatment of these patients, you usually have to provide adequate fluids with fiber intake, in addition to surgical management via the rubber band ligation. And then anal fissures is another common cause of the lower GI bleed, which is due to the stretching of the anal mucosa that causes tear in the mucosa. And so a common cause of the anal fissures is constipation. And so treatments of these patients are generally directed as management of the constipation. The next condition is the colonic cancers, and I have discussed the mechanisms of colon cancers in a separate video, so here I'm just going to provide a quick summary. So colonic cancers are generally seen in patients older than 50 years of age presenting with rectal bleed. So in fact, if you see an elderly patient presenting with rectal bleeding, the first thing that you should be suspecting is the colon cancer. And so due to the cancer, these patients also present with weight loss as well as abdominal pain. Now, depending on the location of tumors, these patients can have different symptoms. So if the tumor is inside the left colon, since the left colon has a smaller luminal diameter, therefore it will cause pencil, stools, and sometimes obstructs the GI tract. In addition, since the left GI tract is very close to the rectum and the anus, the type of blood that you see is a fresh, bright blood. On the other hand, tumors that are on the right side of the colon, since the right side has a larger luminal diameter, they usually don't cause any obstruction. But then since they are further away from the anus, they usually present with maroon colored blood or melena. The next condition that causes lower GI bleed is angiodysplasia, which is usually acquired later in life, and a risk factor actually is an advanced age. And so the presentation of angiodysplasia is dilated and thin-walled vessels that are only lined by the endothelium. So while the exact pathogenesis of angiodysplasia is not known, it's thought that due to the low-grade obstruction of the submucosal veins, so obstruction of submucosal veins over years will result in the dilation of the draining areas. And so that's why that angiodysplasia presents with the dilated and thin-walled vessels. Now, some of the predisposing conditions to angiodysplasia includes the end-stage renal disease, von Willebrand disease, as well as aortic stenosis. And so the type of question that you may see on the exam is that a patient presents with lower GI bleed, the colonoscopy is done and the colon cancer is ruled out. On colonoscopy you see dilated and tortuous veins. What is the diagnosis? And so then the diagnosis would be angiodysplasia. And then the other question that they may ask you is that what type of test should you order next? And then among the answer choices they include, for instance, the echocardiogram, which can help you with the diagnosis of aortic stenosis, which is one of the predisposing factors to the angiodysplasia. The next and final condition is the inflammatory bowel disease, which is divided into two types, the ulcerative colitis and the Crohn's disease, and I have discussed these two diseases in details in separate videos. So here I'm just going to quickly summarize. So ulcerative colitis is due to the inflammation of the colonic mucosal layer that always affects the rectum and presents with a bloody diarrhea. On the other hand, Crohn's disease is caused by the transmural inflammation that can affect any part of the GI tract from oral cavity to the anus, but is most commonly affecting the ileum. and then it commonly spares the rectum, and diarrhea can be with or without blood. So if we had to compare ulcerative colitis with Crohn's disease, it's ulcerative colitis that is most commonly presenting with bloody diarrhea, while Crohn's disease can be also presenting with non-bloody diarrhea. So since Crohn's disease is affecting the ileum, as a consequence of which there is decreased absorption of bile salts as well as decreased absorption of fats, therefore these factors that can cause non-bloody diarrhea. While with ulcerative colitis there is mucosal inflammation and erosion that causes bloody diarrhea. And that concludes our discussion of the common causes of lower GI bleed.